case for legalising some drugs.
Yeah, Christine joined us earlier. Matthew Lesh is joining us now. He's from the Adam Smith Institute, who've been advocating decriminalisation of drugs for decades. Why? Lots of people think that's really irresponsible.
Look, I think it's pretty clear at this point that the war on drugs has been a complete and total failure and has resulted in so much human misery and so much tragedy. It simply, the more we try to crack down, the more problems it creates. And we've seen the result of is in these record numbers of the record numbers of drug deaths in Scotland, and also the highest in 28 years in England and Wales. The reason why we support decriminalising and even legalising drug use is because the harm that the criminal justice system being involved in drug use causes. It results in people unnecessarily having criminal records, and for what are minor offences that don't necessarily harm other people. It results in life-destroying situations. It also results in a lot of stigma. That means people who are struggling with drugs don't come forward for treatment. And we know the international evidence is pretty clear on this. When Portugal decriminalised drugs in 2003, it resulted in fewer drug deaths and less STI transmission. So what we're about is getting the support to those who need it and not having the criminal system involved in people taking drugs.
How far would you go, though, Matthew? Presumably you'd want to legalise cannabis, Class B drug, but some strains of cannabis now are really, really strong and do lead to problems of psychosis and so on. So, or would you want to just legalise the lot? Heroin, speed,
well, our view is to legalise and regulate the drug use. I think you're absolutely right that we've seen an increasing potency in drugs. When you're buying something on the street, which people do every day, sadly, it's unregulated and it does lead to dangerous substances, it leads to contamination. There's no quality control. By legalising the trade, particularly cannabis being an excellent example here, as we've seen in quite a number of US states and in Canada, you can actually control the potency and you have some quality controls. You know what the quality of the product you're getting is because you've got an ongoing relationship with the person you're buying it from. So you actually end up with less potent substances and more controlled. Now, I'm not exactly certain the extent to which you go with decriminalisation and legalisation. What I can say is that the current system is clearly failing, and we know it's failing because a lot of the harm that comes from it is actually from the involvement of these criminal gangs, the fact that all the child exploitation, the teenagers involved in trafficking drugs, and for illegal cannabis, these are all terrible things going on, as well as obviously the knife crime and that we're seeing in London. I want to take that market as much as possible away from the criminal for illegal cannabis. These are all from it is actually from the involvement of these criminal gangs, the fact that all the child exploitation, the teenagers involved in trafficking drugs, and for illegal cannabis. These are all terrible things going on, as well as obviously the knife crime and that we're seeing in London. I want to take that market as much as possible away from the criminal gangs. I think it starts with cannabis, and then we can have a further discussion about other drugs and try out cannabis and try legalizing cannabis and see what happens as a result. And I think we'll discover, as they've discovered in many parts of the US, that it doesn't lead to the end of the universe. It actually leads to a lot more people having a safer experience with drugs and having an opportunity to take a substance that is, to them, in most cases, relatively harmless.
So you want to remove cannabis from criminal gangs selling it. Who would sell it?
Well, like any other business, you'd probably have dedicated shops that if you were of age, you could walk into and choose as an individual whether or not you want to take cannabis. I'm not that interested in having cannabis. Some of my friends have had it in the past. They find it quite useful to relax in places where it's legal to be had, and that's pretty well known to be taken safely. I mean, cannabis is, I think, an absolute no-brainer. We know it's less dangerous than alcohol. We know it's less dangerous than smoking, and yet we allow people to do that, and yet we don't allow people to have cannabis for reasons that are totally backwards thinking, and it causes so much harm as a result. And we could also have an industry with lots of jobs, a bit of tax revenue from the government in these struggling times for the public coffers. There's loads of benefits that could come out of legalising cannabis.
But it's not just our legal regime, if you like, Matthew, is it? I mean, it seems that Scotland is an outlier, but England and Wales also, we have much higher drug fatalities than many countries that have very similar drug laws to us. Yes, we're not Portugal or the Netherlands, but our drug laws aren't unusual compared to, say, France or Germany, yet the rate of drug deaths does seem to be unusual, particularly, unfortunately, north of the border, but also elsewhere across the UK.
And I think you're right. I don't think legalization is going to solve that alone. I'd actually like to see a bit more discussion about drug consumption rooms. This is the opportunity where people can safely go and take illicit substances. It doesn't necessarily require you to legalize the substances, but they've been shown across the continent where they are used to save a lot of people's lives, and they reduce drug-related deaths, and they reduce health burdens and decrease public injection and syringe litter. There's despite concerns, they don't actually increase drug use. But what they do is, for example, if someone's homeless, it means rather than potentially taking some drugs, having an overdose and tragically dying, that they go do it in a relatively safe context with people who are there to help them, but also there to people who can talk to them and try to move them off drugs and provide a safe ramp into public health services, particularly for someone who is homeless, who might not otherwise have much interaction with public officials. So I think something like drug consumption rooms might be a key point where the UK is actually behind much of the rest of Europe in terms of reducing the deaths that can come out of particularly heroin use, and what we're seeing a lot of in Scotland. I think the Scottish government wants to introduce drug consumption rooms. I think they should be allowed to do so if they want to try that as a solution to what is such a tragic reality up there in Scotland.
And they tried to do a pilot of a drug consumption room in Glasgow in 2018, but the Home Office blocked that pilot. It was 3 years ago. Do you think there might be a change from the UK government?
Look, I certainly hope so. You can have an argument about what is a devolved responsibility, what is something that the UK government should be doing itself. Honestly, I think that's just all politics and getting in the way of what's a more important factor, which is saving people's lives. And the fact that Scotland has the highest number of drug deaths on record, and they have the highest number in Europe. This is a national embarrassment for the UK at large, and we should really be throwing as much as we can at that problem. And drug consumption rooms have been proven effective elsewhere. They might not be a panacea, but if we can just try something to save people's lives, I think the moral case for that is overwhelming.
Okay, Matthew, you're from the Adam Smith Institute, a very well-connected, long-established think tank there in Westminster. You've got very close relations with the Conservative Party. Obviously, you're independent. But you know, as I know, as Gloria knows, that the Conservative Party is extremely nervous about this agenda. We just heard from Mark Francois, stalwart Tory backbencher, and when Elizabeth Jardine Christine Jardine put the idea forward to him, it was just no way, Jose, it's not going to happen.
Well, I think that was a very disappointing response. You know, I understand for a lot of people, legalization or decriminalization might be quite an extreme position, and changing the legal status of drugs, I will be the first to admit, is something I don't expect to happen today or tomorrow. But something that is a health intervention, I think we've got to really take that out of politics. And you know, I respect Mark Francois, and he's entitled to his opinion. But I think it's disappointing if we're not willing to at least experiment with what could be a solution. I mean, I could be completely wrong. It could lead to a complete disaster of some description. Hasn't elsewhere, but it could. But we're only going to know that if we're willing to try the solution in Glasgow, in somewhere that's struggling so much with this issue, and allow the Scottish government to try the issue out. There's a lot of complaints about the relations, obviously, between the Scottish government and the UK government. In this case, I have to be quite sympathetic to the idea that public health is very much supposed to be a devolved issue. It is the responsibility of the Scottish government to try to solve this issue. They have so far failed to do it, but if they've got an idea and a way they think they can solve it, I don't think it's right for the UK government to prevent them from doing that.
Matthew Lesh of the Adam Smith Institute, the debate will continue.